What's up, everybody? This is Beck Moore, podcast host and CEO of Community Action Association of Pennsylvania. With me today is my fearless co-host, Heather Holloway, Holloway Media Services. What's up, Heather? Bow, bow, bow.
I love that you have not one, but two titles. So I'm going to say I'm co-host and optimist extraordinaire, Heather Holloway, and I'm so thrilled to be here. Thank you so much.
Happy to see you. It's been a bit. You've been busy?
You always say that.
Well, you've been busy. I've been busy. I feel like I've recorded like 5 episodes without you.
Where's the calendar invites, Jen?
I don't know. You know what? It's just everybody's been...
Not Jen.
Jen, shout out to Jen, my executive assistant.
Shout out to Jen.
Scooby-Doo, as we affectionately call her around here. I don't know what I would do without her. As I tell her all the time, there would be no CAAP without Jen, so I appreciate Jen so much. But also today with us is my bestie, Amanda Shelton.
Hey.
I made the mistake of saying once when I was at your conference in Texas, Amanda, that I am basically Amanda in Pennsylvania, and somebody in the crowd was like, no, you didn't.
You cannot claim that. No, I did the same thing at your conference, so it's all good.
Not nearly as fabulous as Amanda Shelton, but Amanda is the CEO, Executive Director of TACAA, the Texas Association of Community Action Agencies. Amanda, thank you for being here. This episode is really about kind of a couple things about community action in general, another person's perspective, running another state association, so doing similar work to what we're doing here in Pennsylvania at CAAP, but also someone who has been in community action for a little while and has a little bit more of some backstory than what I do for sure. And so different perspectives. Just really happy to see your face today. So thank you for being here.
Same. Thank you. Happy to be here.
So Amanda, just kind of some softball questions as we ease into things. So remind me how long you've been with community action and a little bit about your origin story, if you will, about where you started in community action and how you got to the association.
Oh, let's see. So if you want the exact number of years, I'm not going to know that. But what I do know is most, like everyone else, I had no idea what community action was. I was honestly just looking for what my next thing was going to be. And, there's a little thing happening at the time. And so I found community action, or really it probably found me. And I didn't think it was going to be, a lifelong career, but it is the only thing that I've done post grad school, and I absolutely love it. And so I was with the local community action agency in Houston, Texas, Harris County for about probably 13 years. And then the most recent 4 years, I have been with the association.
Yeah, we started like around the same time ish. Yeah, I would say right around the same time. But while at the local community action agency, I did any and everything community services block grant, backwards and forwards, through and through, worked through some of the most difficult disasters that we had in that area before transitioning to the association. And so you are from Houston originally.
Yes.
And right now you're in Austin running the association, but just like CAAP, right, you cover the whole state. And if you can, just for some perspective for our listeners also, how many agencies do you have there in Texas that you support as the association, or how many organizations are there in Texas in general? And then public versus private for our listeners, right? Reminder that we got some folks that are, some agencies that are public, means they're embedded in local county government, while others are considered nonprofits. And every state has a mix. So here in Pennsylvania, we have 42 agencies. So Texas, Amanda, if you can just kind of share that perspective.
How many counties do you have?
We have 60. What do we have, Heather? 63 counties in Pennsylvania?
But it's not the size that matters, Amanda.
Well, I just want to brag a little bit because he has 43 agencies now. So we have 38 community action agencies in Texas, and it covers all 254 Texas counties. So scale, we have some very far-reaching areas, and some that have some pretty large service areas, honestly, like 30, almost 40 counties. In terms of our public versus private, of that 38, around 10, 12 of them are public entities, and ours looks different. Some are county governments, some are cities, some are actually the counties themselves operating, and that's mostly concentrated in the very metro areas of Texas. Other than that, it's the private nonprofits, and again, expansive reach in terms of what they do.
Yeah. So we have 67 counties in Pennsylvania, to be clear. I just needed a moment for my brain to connect the dots.
Sorry.
But, and I want to say I've driven through Texas. I've driven through the longest part of Texas and took me 3 days. So, and I've, visited Texas a number of times for different conferences, including yours, Amanda. So, spent a little bit of time in Texas, but yes, Texas is far larger than Pennsylvania. We'll say that out loud. The difference is just, I think the grouping of our agencies versus yours, we have far more that are singular county than what you all do there. So it's one of the kind of the distinct differences. So what we were saying was a little bit of the difference is that Texas has, whereas Pennsylvania has singular county agencies, whereas your demographic of your agencies, right, comprise far more of multiple counties. Because how many counties do you have? 250?
254 Texas counties. Yes. So in our case, most of our single county entities are going to be in our really large metro areas. So, for example, when I was working with the Houston entity, I only had Harris County. Now, Harris County, though, is the fourth largest county in the United States. So our CSBG line item alone for some exceeds what some other agencies receive as well around the state.
Oh, absolutely. So thank you for the backstory. I just want to help our listeners kind of level set around some of the differences. So again, I think everybody who listens at this point has heard us talk about community services block grant is the one unifier across all community action agencies in terms of our funding. But as we've talked about pretty often, right, local response is based off local community need. That's part of kind of the secret sauce of what we do. So as we kind of think about your origin story a little bit more, how has your perspective shifted at all in terms of kind of how you saw community action as a local agency rep staff member versus today as the association? How's it changed? Sort of how's it broadened?
I think it's a great question. I think for myself, especially toward the end of my career there, it was so focused on crisis response. In Harris County, in that part of Texas in general, we saw Hurricane Harvey. We saw the freeze happen. We saw there was another flood that didn't make the same national attention, but we saw this crisis response that happened year after year, sometimes twice in a year. Now, when I think about how we talk about community action and looking at all of Texas and all the nonprofits that I have just the privilege and pleasure to support, it's how do we talk about community action in a way that goes beyond this very singular community driven, but really talk about what is the economic driver into what we're doing, right? In some areas, no, this wasn't my experience, but in some areas of Texas, for example, the Community Action Agency is the largest employer in that particular region. And we don't hear that conversation quite often. And so I think for me, just a need to shift how we really talk about the work that we do, the impact, the results, and how we invest into communities is even more important now than what I realized when I was directly so close to the need and the solution. I think I've gained just broader perspective overall of the work and the differences, but also what is the piece that kind of weaves us together. Yes, it's community services block grant, but really it's the economic drivers of what we do that we should really kind of hone in on. So personal mission, I would say.
Yeah, well, it's hard, right? Because when you're in it every single day, and unless there's any reason for you to be linked to the association in the very beginning and or the broader work, you're in it, right? You're doing the thing. And so to be able to see that larger perspective is difficult. And so I think it's one of the things in Pennsylvania, we've got something like 4,800 employees, across community action in the state. If you look at us collectively across the country, the way that we like to talk about ourselves is that we're one of only 15 nationally networked human services providers, right? And that has power. So when you think about then the collective number of people that we're serving, but when you're in a local agency and just so in the thick of things, you just may not see it that way.
Yeah. It's easy to have the blinders on. Yeah. Yes, we're learning from one another, but it's just because we're so close to, solving the problem in the community. And that's what we're intended and supposed to do. So I think that's what makes what you and I do kind of unique in that way.
Yeah. Heather, do you have a question?
Yeah, I do. Yeah, actually, thank you so much. Yeah, Amanda, you said that you've been working in it for about 20 some years now, give or take, a couple
Yeah,
decades, give or take. You're looking
let's take.
fantastic.
Don't give me more. Just
Okay,
take. Yeah, yeah.
all right, all right. I'm curious, to folks out there listening right now, the longevity. You've been there. How do you not burn out from the work?
Ooh,
Finding your bestie. You get that's shameless plug here.
yeah, yeah.
I mean, it
That
helps.
is part of it. I think as you kind of like navigate your way through the work, and if I had to think back on it, there have been times where I've had to stop and really ask, what is my why? What's my reason? For myself, I've always kind of come back to the same answer, even at different points and different perspectives. And also realizing that to do this work, very challenging work, very complex problem that we're trying to solve, to do the work, you have to first take care of yourself. And I haven't always appreciated that. I think these last 2 years have made me appreciate it a bit more. I haven't always appreciated that, but showing up for myself the same way I had to show up for my team. I had a team of 35 individuals, and now showing up in that same way when I have a much smaller staff. But really taking care of yourself first and foremost, but also really centering and figuring out what is the reason, what's the driver behind what we do. Because, unfortunately or fortunately, we don't always have like the end point. There's always something that we're trying to figure out. There's always the next thing that we're trying to do really well. So having that moment is the pause, reflection, and then it kind of gives you the fuel to continue.
Yeah,
I think it's so what you said is certainly important. We've talked about it a lot. I know, Heather, you and I have talked about it. It's something we both speak about. The challenge for me oftentimes is that, yes, trying to take care of myself, but also you're trying to take care of the people that you're supporting in a different way than the clients of, or right, participants of community action, right? I'm trying to take care of the professionals that are trying to support all of the folks that they're serving. And I don't know about you, but that adds another layer of pressure and less ability sometimes to take care of myself. I mean, partially because, as we've talked about, I'm a Virgo and I can't help myself and I'm a fixer. And so that's part of my problem. I know, I will own that. But there is, right, like I care deeply for the people that I'm serving and know if they ask a question, they really need something. They're really vulnerable enough to ask the question of me, right? I'm not in the work every day. And so then how quickly I get back to them or how quickly the team gets back to them, it comes with a different type of sacrifice almost, or different type of pressure, because you know how hard they're working and trying to match pace. And so I know that for me, that's one of the challenges of this job. I don't know how you feel about that.
Definitely a challenge, although I'm not a Virgo, and we can, spend time later talking about our zodiac signs, but I am a recovering perfectionist. And so for myself, thank you, Heather, for that, little amen I got. But for myself, it's been really important to celebrate the small wins and not just to know them, but to actually take time to celebrate them with my team. As someone who always, I'm setting the bar high and then higher the next time. And what can I go past that? That part has been really important. Not that I always remember it, but it is something that I try to just practice constantly.
Do you have a follow-up question, Heather?
I can, if not, unless you have one.
No, I do. I just wanted to make sure to ask.
Yeah, go right ahead, brother.
So as you think about, again, kind of that evolution of community action and your understanding and the work that you're doing now, and you think about part of our job at the association, regardless of how you look at training and technical assistance, right, regardless of how you look at staffing and sizes, things we always talk about when we're sort of in a room together as associations. But when you think about part of our job being that we're supposed to be telling the story of community action, where do you feel like and this is not a criticism, to be clear to anybody who's listening, that is listening from another association, I think we all have to strive to do this better. But when we think about how to tell the story, what's our miss? What's sort of the messaging that we should be focusing on differently? And I think you hit on it a little bit ago when you talked about the economic drivers of community action and what we create. But
yeah, I think that's a a big one. I also think just understanding our audience, and I don't think we always take the time to really try to understand who's the receiver on the other side, right? And so tweaking that message of what we're doing and to whom we're doing it for. And also, I think the piece that we miss kind of like within that as well is who is the person carrying the message. It doesn't have to be the staff person. It doesn't have to be the executive director. It can be the county judge that sits on the board that has a completely different perspective and is going to draw people in a different way. I think we missed the opportunity for it to be the actual child in the Head Start classroom, the same way that it could be the person responsible for the affordable housing units within a community. That part, I think, is we've somewhat missed the mark in talking about what we do, even if it's to use the same words, the same language, but a different person communicating that message could speak volumes in a way that, us bragging on ourselves is not going to do in the same way.
Yeah, no, I think that's fair. Go ahead, Heather.
From the marketer on the call here, amen, preach it, say it loud enough for the people in the back, because the ultimate question is, who can relate?
Yeah.
Your messages have to answer that question. They have somebody raise their hand and say, me, 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 me.
Yeah, yeah.
Well, and I think a lot of times in this work, part of the challenge is, right, like we think about homelessness, for instance. It's something I know that we've touched on a couple times on this podcast, is that unless you've been housing insecure, unless you've been worried about paying rent, it just doesn't seem like a reality to you, right? So, and even if you hear the story, there's still some form of, right, like perspective that you bring in terms of, well, somebody should have done this differently, or they should have made this choice differently. So unless you've been in that situation, you just may not think it's real. And so how do you tell the story in a way that, to your point, Heather, right, appeals to somebody, that it suddenly connects differently to, oh, this is real now because I have this thing that's in common with this person, or I have this thing that, overlaps with this person.
And if I can just add to that, I think in how we talk about ourselves in community action, a lot of what we're trying to break through is already the misconceptions around poverty itself. And so, once we start talking about the fact that most people are closer to poverty than they are closer to stability, and this is everyday working individuals, right? Once we start talking about the fact that people are working really, really hard, really darn hard, I want to say something else, but they're working extremely hard just to make sure they're in a place where a normal, basic day-to-day interruption doesn't throw them back into a place of instability. That's the part that we have to start talking about. We know people are talking about affordability. We know people are talking about, rising everyday prices. Where do we center ourselves in that, and who's going to relay that message? I think we have a big responsibility to be a part of that and talk about it in that way.
Yeah, absolutely.
I can imagine that your role today is just a wee bit different than, say, 2 years ago. So I'm curious, a little bit, yeah. What's it like right now? Like, what is it like in your role on the street versus, say, 2 years ago? I imagine stakes are higher.
This is my question or Beck's question?
That's your question.
I mean,
that's a me question. No,
I mean, really,
I'll answer first if you want me to. I mean, I think go ahead.
No, go ahead. I will follow right behind you.
I mean, it's one of the things you and I have talked about before. Like, I didn't take this job to be a politician, and I feel like I find myself in a spot where I have to be a bit of a politician. Thankfully, I've hired a director of public policy who, comes from a world of politics and understands all the things far better than I do. And so I've been able to step out of that space a little bit, but it's certainly something that it's just a constant pivot, and trying to figure out the messaging that resonates with the next person. And that, when you go in one office versus another office, there's going to be naturally things that appeal or don't appeal. And so trying to figure out, when you're doing the advocacy and the lobbying work that we need to do right now, it's one of the things that is certainly, I think, yes, it's a part of what we are supposed to be doing as an association, but there's also a whole other slew of things that we're supposed to be doing as an association. Yeah, go ahead.
I'm going to I guess, piggyback. 2 years ago, if someone had asked me, would my role be convincing everyday people or decision makers even that people's lights should stay on, I don't think I would have told you yes. Or trying to package the message in such a way where you can believe that it's important that, a child have access to a quality classroom before the age of 5, before the age of 6. I did not think that part of the work would be become such, I guess, a huge part of what we do now, day in and day out, especially in the last 2 years. Yeah, that's where I have to end on that one. But
yeah, I hear like,
couldn't have told me.
The majority of your time, sorry, Beck, you're wiping your eyes here.
No.
The majority of your time used to be helping the people that need help. Now it sounds like half of that time is convincing, these folks need help while trying to help. It's like you're being pulled at both ends.
Yeah. Or understanding the decisions that you're making means more people will come through the door. However, there's a belief of some people that the work is not important. And I can understand the work doesn't require additional investment. I can walk down that road. Or should the work stay exactly the same? Okay, I can walk down that road. But the fact that it's called into question, should it even exist, is one that I did not expect 2 years ago.
So I had to take a ride in an ambulance recently, and the ambulance driver was asking me what I did for a living, and I was explaining what I do, and I said I work at Community Action, and that we basically help community action agencies who do this work, right? And he said, oh, that's the work, that's what churches should be doing. Now, we could have a whole conversation about the fact that, we were listening to the whole time Christian rock, and I, was feeling a little proselytized to the whole time in the ambulance, but I'm not going to go there. But what I think is so interesting about what he said is that, yes, of course, faith-based communities should and are helping people. However, faith-based communities cannot do it alone. Nonprofits can't do it alone. Healthcare can't do it alone. And I think the misnomer right now is like part of one of the myths that I feel like we're busting is that any single entity can do it by themselves. Because like it or not, right, the world is comprised of lots of different people, and people's comfort level walking into a church to get help or a place of faith is very different than the next person. And churches alone, right, are reliant on the congregants that are coming to that location. And if people who are walking in through those doors aren't willing to provide help, right, because maybe they don't believe that this is a reality that people are facing, I just think it's such an interesting and far more complicated perspective that people need to open their minds up to. And I was just really taken aback when I'm in this ambulance dealing with, a situation that I was dealing with, and then hearing this man talk about this. I was just like, this moment where I was like, I want to school you on what you think you know, but I also don't have the mental capacity right now because I'm dealing with a crisis.
I also need your help.
Right. It was not, right. I personally was fine, but there was someone in the ambulance that I needed to make sure to take care of.
Right. It just going to tie it in, but going back to something that Heather mentioned earlier, like who carries the message, even in that, because it's important that that the help comes from the faith-based organization is what the person was saying. Imagine for those agencies where the faith-based organization is such a significant partner, if that faith-based organization is the one that's saying, hey, we're able to do this because a community action agency, blah, blah, blah. And then he can make those, he, she, whoever it was, can make those connections, I think, differently versus hearing it and, oh, someone else should be doing that. Why not make all the connections if the right person was, carrying that message? Not that you want the right person back. I'm just saying.
No, it's right.
Imagine.
I was not
in a different setting.
To be clear, I was not in that moment because I was just like, I don't
right.
know what to say to you, and I don't have the capacity to think beyond what is happening in this emergency. Well, and I think the other thing is, right, within community action, in Pennsylvania, we have 1.2 million people living in poverty. That means 100% of the federal poverty guideline, which is, if Google it, friends, if you're out there, right, what that actually means in terms of household income. But suffice to say, it's not a lot of money. And then community action, right, depending on the state, are then working with folks that are slightly above the poverty level. So those people who are the one emergency away, right, from being back in a situation that they've overcome. And I think that's the other thing, right, is that this perspective on the gap that exists with benefits cliff. And as people were becoming more economically mobile, right, the actual household salary that it takes and the amount of time it takes to get there. Because I don't know about you, but the jump from, making $30,000 a year to $75,000 a year took a little bit of time.
Yeah.
As it does, as you get your skills, as you advance, you find the right person, you find the right business. We'll talk about misconceptions of a church should handle the work that you all do. What are some other common misconceptions about community action that need to be addressed, Amanda? Especially if there's another executive director out there trying to find that messaging.
Whew. Other common misconceptions.
Anything that lights you up or gets you like, oh, I wish they understood this.
I wish we talked more about our work around the causes of poverty. And instead of for our primary focus seems to be the message of how we address the conditions of poverty. And there are several community action agencies around the country that are doing some really incredible work focused on just the root causes of poverty. Those stories we don't talk about. At least in my mind, in my 15 plus years of doing it, we don't talk about those stories in the same way. And also think, just going back to something I said earlier, it's not just the misconceptions about our work, but to whom we're doing that work for. And I think just a lot of education and talking about poverty in a different way needs to happen for there to be a deeper understanding or even possibly an appreciation for the work that we do. Yes, some stories are around, it was, I was making 30,000, I went to make 75,000. And there's some stories that I've always had a thriving career and then a fire happened. I've always had a thriving, I've been in a place of stability, and then there was a medical emergency and that medical emergency shifted. Or I had a place in a company and things were going great, and then they decided to downsize. And due to the workforce and the current landscape, I was not able to put myself back into XYZ position. We don't talk about that enough. And I think if there is an executive director, an agency, a program director, whoever is listening, the next marketing professional, it's finding those pieces of the story as well. And then again, also recognizing who is the intended audience at the end of the day and who should carry that message forward. So if we can address some of the misconceptions just around poverty, realizing there is no face of poverty any longer, I think we'll get closer to people better understanding who we are.
Yeah, as our board chair, Megan Shreve, says here pretty often, is that we do micro and macro level work, but we don't often talk about it that way. I mean, that's when you think about kind of we're going to get into some of the really sexy, amazing part of community action right now. Think about the data that we have access to at community action. How do you think, and now we'll also preface this by saying that there's a difference between outcomes versus outputs, right? And I'm not going to get into that whole level of discussion and, try to talk to everybody about logic models and why that matters. But we do have access to a pretty significant amount of data within the work that we do. How do you, if you could wave a magic wand tomorrow and to be able to leverage that data differently, any thoughts about what that might look like? Sorry,
You're on the hot seat.
It's not a question we prepped for. I know it's just I'm thinking out loud.
If I could wave a magic wand and take the 40 years of data and
how would you utilize it differently than the way that we've been utilizing it? Because I think one of the things that I said at a lot of healthcare conferences, I've been to a lot of healthcare conferences, and one of the things that a lot of times is like, oh, well, right away within healthcare, it's like, oh, we should do a study on this. We should do a study on that, right? We should talk about how poverty, makes us more likely to experience these things from a health outcomes, perspective. And we should do a study. Well, the thing is, right, like there's more studies than you can shake a stick at. I don't think we need another study. I think it's all about accessing the data that we have available to us to be able to showcase things differently and through a different lens or perspective. How should we be really leveraging the data that we have available to us within community action? What would that look like, right? If you could wave a magic wand tomorrow.
In Texas, if I could wave a magic wand, I would say if I could take some of the decisions that are made within our state and overlay that with who are the neighbors that are walking through the door, and use that data to say, this is what your decision is going to mean in 5 years and 10 years and 20 years and 30 years. I would love to be able to have that type of influence on policy with the data that we have at our fingertips. I know right now our data isn't sliced and diced in that way. But if I did have, I guess, a magic wand, I would love to be able to do that.
It really helps paint a picture. That really helps paint the face, right? The who is it being affected? And how your decisions today are going to affect tomorrow. And like you said, it's one moment away. Yeah.
I mean, even we talk about LIHEAP all the time. In the state of Texas, we're unique. So LIHEAP, weatherization, CSBG all flow through, for the most part, our community action agencies. And we talk about LIHEAP all the time. There's a piece that we don't talk about. It's the appropriation for the state of Texas is enough for only 1/8 of those who qualify today for that assistance. We don't talk about that. And so if I could take that picture and then project take the projections of what they think utilities are going to cost in 5 years and 10 years, especially with the introduction of data centers and changes in population growth in Texas. What does that mean? What does that mean from a policy perspective of what Texas should receive or what Texas could receive if we had that information? So, like you said, paint a different picture, but hopefully with the ability to influence some considerable policy.
And for folks who aren't aware, I don't know that we've talked about LIHEAP a lot on the Thinking CAAP. So do yourself a favor, Google, but Low Income Housing Energy Assistance Program. Look at me, knowing some acronyms.
Proud.
Once in a while, I'll pull one out. No, I think that's real, because I think we know that we're able to predict certain energy costs. We know that we're able to predict, within reason, temperatures and how temperatures fluctuate. I use the example pretty frequently about my own heat at my house. We have oil heat. We have the rule, no heat till trick or treat. Poor kid mentality sticks with me. I can't help it. So if I can get to Thanksgiving without turning my oil heat on, I'm in, because that saves me $500 a month. And right now, I don't think I need to tell anybody oil is expensive right now. And it just got to last week, it was like 90 degrees in Pennsylvania. This week, we're back to the 30s. So I just turned my heat back on. I was hoping to, we manage our budget pretty specifically here in the Moore household. And so that little bit of heat costs, look, if you're trying to get out of debt like my house is, it's important. Every little bit matters.
Absolutely. And then you try to offset it with electric heat. Forget about it,
Yeah.
because electricity is on the rise.
Well,
and
I was going to say, not to make light of it, but then the flip side is we have window units, because I ain't Texas, Amanda. We're in Pennsylvania. Funny story. I was putting plastic up on my windows this year in an old house. And so, Heather, I'm sure you know what I'm talking about, right? You get like the wrap, and you get the hair dryer out, and I'm out, blow drying my windows. So I sent Amanda a video, and she's like, "Why are you blow drying your windows?" And I was like, "Well, welcome to Pennsylvania. We have an old house. Every little bit of heat matters."
And I want you to know I've been quiet for the last 5 minutes because I don't know what you're talking about.
Amanda's like, I don't get it.
I have no idea. None.
Yeah.
Yeah, there's some.
But I do know that oil is more expensive. Yeah, I do know that.
We have people in Pennsylvania who have coal, right? Like it is wild heating systems up here in the Northeast, Amanda.
And I mean, I bet if we pulled it, so yes, our states are very different sizes, population percentages and all of that too. But I bet Pennsylvania receives considerably more in LIHEAP than Texas does.
Yeah. I would imagine so. I don't know those numbers off the top of my head, but yeah, I would absolutely imagine so, because colder temperatures, right?
So the question is, how can state and local agencies strengthen their partnership? Have any ideas there?
I feel like I should start with the fact that Texas has a really good relationship. So in our state, we have a pretty good relationship, even though it looks different than some other state associations and also with their local CAAs. And that's something that we built over time. I think if I think about the bit I do know kind of around the different states, I think the best partnerships and relationships are the ones where state offices remember that there are people involved in the process. The state offices, because they have the oversight, it's easy to get very narrow focused on the compliance portion of the work and the monitoring portion of the work, and forget the kind of human centeredness of what we're doing. And also just, for the communities. And then on the flip side, right, because it's a two-way street in relationships, should be. On the flip side, for the community action agencies, is also understanding that the state also has their piece, right? And so as much as we are looking at the human-centered perspective and the systems and, how do we create these transformational opportunities, it is the fact that there is a very compliance and monitoring driven portion of that. And they don't always go in parallel, right? And I think that's just a part of that dynamic within that relationship. Monitoring compliance at least in my experience, has never been as innovative as what you see at like the really local level. Compliance and monitoring just doesn't move that quickly to become innovative and kind of catch up to what's the next thing and the next need. So I think kind of just both understanding those dynamics and having respect in the kind of push and pull that can be developed. But with any relationship, the transparency is important. The communication is critically important. And having the same baseline goal in mind, I think is what creates strong relationships between the two. Not that I'm a relationship expert. Anyone listening, don't take it as a grain of salt.
Well, listen, you've been in this role. You know a thing or two. Are there any books that you've read on relationships that have gotten you, where you need to be? Any guidance on leadership and how to, negotiate? What's some of the top skills that you need to know both ends of the story?
I
We going deep. I'm trying to see in that vault. Like,
I
how did you
see. So nothing that sticks out in terms of anything that I've necessarily like read recently. But from where I sit now with the state association, being laser focused is just never, not laser focused. I don't think that's fair. But being narrow minded, let me say that, is never a way to win, let's say, the argument. We take in a lot of information. We filter a lot of information on a day to day. We have a responsibility, of course, to our members and all of that, but also it's that same respect that we have to give to the other stakeholders in the room. And in our case, it's our state office, right? Or it's even the federal office. And so it's a interesting balance, I think, that we have to play. But again, the transparency, communication are the two pieces that must go hand in hand to be successful.
So as you think about kind of every state, every time there's administration change, just like on the federal level, right? Priorities change, different perspectives are brought in, and it feels like part of the challenge in running organizations like this is just the ever shifting kind of landscape of priorities, funding landscape. When you think about kind of the evolution of your organizations in Texas, what advice would you say to organizations in order to stay nimble and be able to be reflective of those priorities and be thoughtful about those priorities?
My personal opinion, this is the new normal. I think we have moved away from, I think we'll see after this, but moved away from 2 consecutive term presidents. And so if we're looking at changing leadership, vision, priorities every 4 years, being adaptable is not, or responsive is a constant in what we do. And, yes, it's a part of our aroma cycle. Yes, it's a part of just a proper way to do business, but it's also understanding that you have to think really outside of, and even in all of this, there's a opportunity, I think, to redefine, reshape how you're doing business. And not only is the opportunity before it becomes a requirement, it's embracing it now. Because I do think every 3 to 4 years, this is what we're going to have. It's going to be a change. And also there's a significant change, I think, that's happening just within communities as well and what their requirements are. So don't just focus on the top down, but also what your community is demanding of you and asking from you is also going to continue to change. I think there's some key beliefs that have been implanted in the work that we do, good, bad, or ugly. Some new kind of like thought processes around taxpayer dollars and efficiencies and waste. I mean, these are conversations we weren't having before. Well, no, I take that back. These are conversations we've always had internally. These are not conversations that the everyday person was having. And now that is a part of people's thought process and belief systems, it requires you to even think about the work that you're doing in a different way. So.
Yeah, I think one of the things that we know that people have this perspective of the work that our agencies do is that we are not at, the compliance that we are required to follow, the rules that we are required to follow, that they're lackadaisical and they created all this room for, problems and challenges. But I think anybody who works in this can tell you otherwise and can point to, 75 rules that they have to follow around insert thing here. Again, do yourself a favor. If you think ask one of the folks who work in this space. Call me. I'm happy to give you a list of compliance and a place where you can access what those compliance rules are. But we are heavily regulated entities that have to follow lots and lots of rules in order to maintain our standing as community action agencies and or as Head Start providers, and or as insert program that an organization within community action space oversees, administers, however you want to put it. Anything else you want to add to that, Amanda? I know that we've talked about that in the past, and I know it's a frustration that we both have.
Yeah, I think the frustrating part is that we don't talk about it, because it's just a natural part of, what we do. But I've even found myself going into representative offices and talking about that exact thing. We are highly regulated because they are block grant funds. The state has oversight to that, right? And what does that really look like? And instead of we're assuming that there's an understanding of how the dollars flow, of how they're invested in communities, and more importantly, like what's the regulatory environment that we're operating in, it is constantly preaching that message over and over again. And of course, to that audience, right? That audience cares that they are highly regulated. We can prove it's not just that we're improving systems, but we can prove that we are efficient. We have to start talking about ourselves in that way. So if there's any frustration, it's less so about the regulation. I can actually live with that one. It is about the fact that that others don't understand how highly regulated that we are, and that we meet those requirements. It's not just that it's a report card. And we're passing, and we've done it consistently. There are not many organizations that have survived 60 years. Not many, forget organizations, businesses, companies don't survive 60 years in as highly regulated and an ever-changing environment that we have found ourselves. So, yes, we should pat ourselves on the back, but also make sure that people understand, like, we deserve a little respect when we walk in the room because we know what we're talking about.
Yeah,
so.
Truth.
Come on. And so to piggyback off of that, what do we have to celebrate in Texas, Amanda? Tell me some good news.
Good things to celebrate. As a network, I think we are really starting to understand our, I don't want to say power as a network, but that we are really stronger together. And so I think at a time that is so, is it divisive? Is that the right word? Divisive? In a time of that, we are stronger because we are together as a network in Texas. And we are finding, even within the kind of fluctuation, the uncertainty, we are continuing to find those kind of creative opportunities that could exist. And in a time where the future is challenged, we are still moving forward as though we have a very strong future ahead of us. And that, Texas can be a difficult place. And I'm not saying yes, there are sometimes barriers created that make the job more difficult, but I absolutely love it, especially as a Texan. I absolutely love Texas, and I love the possibilities of where we can go and how we can go forward. And so, we've launched some new initiatives. I've learned from others like Beck on just possibilities of when you kind of move as one. And as a network, I think we're all kind of having that aha moment together. So that's really exciting.
Well, we're stronger together than one voice, right? When we all unify in whatever ways we can, it creates great opportunity. Yeah. It's part of what the success has been here in Pennsylvania that we're excited about continuing to manifest. Heather, were you going to ask another question?
I'm just looking at the questions and I don't see any right now. Go for it.
Anything in particular, Amanda, that you want to shout out, or things that are coming up that you're like, hey, want to call this out? I know you've got your conference coming up. That's, by the time this episode airs, conference will already have happened.
Yes.
I know you got a birthday coming up in a couple of days here. So happy birthday in advance.
Thank you.
We're going to be doing some work together, partnering on our summit that's happening in May during Community Action Month.
Yes.
Which I'm excited about working with you all and hopefully some of your members.
Say more. How are you partnering?
Yeah, so we created an opportunity to share over our summit, our spring summit, with other associations. We want to make sure that we know right now AI is so important, but not losing that human-centered approach to AI. And I know Amanda feels similarly to myself. And so we'll be hosting our summit May 20th and 21st, virtually and in person. And so created a pathway for Texas to be able to participate in
all of Texas,
the virtual experience.
That's awesome.
Yeah.
So shout out to our Texan counterparts that will be hanging out with us in May.
Yes, exciting.
Wow, AI and human centered work. I mean, do they go hand in hand?
Look, as someone who just experienced a hell of an intake process dealing with a mental health crisis, I went through intake 16 times in a single day. 16 times. First of all, let me tell you, when you're dealing with a really hard situation, have to repeat yourself 16 times while you're still standing in a hospital is exhausting. So we can say all we want that we have a human-centered approach in this work, but our systems don't talk to each other. And so you can be as kind as you want. By the time I got to number 16, I was exhausted and not very kind to the poor person who was answering the phone. There's got to be a better way. And I plan on talking about that more on stage when we get to Summit. But let me tell you, I think that it's not just about the singular organization, right? It's about the system in which we work. And there's just got to be better ways of making these things work so that it reduces time on, the people who are experiencing the intake process, but also the administrative burden on the agency's part. Imagine if those 16 different groups hadn't had to do intake that many times and they were able to just reflect on, right, the very first time the discussion happened.
Yeah.
And the way I kind of say it, Heather, is like, let the robots do what they're going to do so the people can do what they do really well. I haven't done a poll. And so, as people listen, they can do their own quiet, nod of the head. But who enjoys taking the documents required for the application process? If you ask, I have not worked in casework, but is that the part that you enjoy? Right? Let people get back to the coaching aspect. I am here I need to build trust with you. How do I do that? Right? How do I show up for you? We always kind of use that saying of meeting people where they are. But what happens when the people say, meet me where I am, but faster, more efficient? We have to respond to that. And again, we are highly regulated, monitored, compliance, all of that. Before someone says you have to do it, start to really think about and embrace now what it will look like, what it's going to mean, because we know it's going to change the workforce. We understand that, right? How do you allow it to change your workforce in a way that works for you? I think we have to start asking those questions. And so I think Beck and I both entered this year saying, No. That was last year, end of last year. We had a conversation about it and both entered this year saying, like, how do we just get people to a better understanding? And I think that's what this opportunity creates, is just understand a bit more about what are all the components of AI. Doesn't mean you need to like them all. Doesn't mean you need to adopt them all. Maybe you need to take a step back and understand, are you even in a place? That's fine too, but we still have to talk about it before it's, the robot that's gone out of control and you can't control, like me and in mine that joins meetings when I don't want it to. I have to get better at it. So it's not just y'all, it's me.
What I love hearing right here is the human isn't replaced.
Oh.
The work is enhanced. You're able to delegate, right? Zone of genius. Your zone of genius is working with the person eye to eye.
Yeah.
Support. The paperwork literally weighs you down.
Yes.
But compliance, we have to do it.
It's required, right?
It's required, right? So what I love to hear, because I think a big fear with AI is replacing. I don't see that in this line of work.
Yeah.
I see enhancing.
Yeah. No, it's I think I just read something about the state of Pennsylvania had done a study with some of their employees who had started to utilize AI, and it was really basic functionality AI, right? Like, so, don't quote me here, but it was like, using ChatGPT to do something. And ultimately, what they were able to track is on average, people were saving upwards to 10 hours a week. Well, 10 hours a week to save so that I can spend 10 hours doing the things that matter rather than the pencil pushing and the administrative burden work. That's a substantial amount of time.
Yeah.
That's over a day.
Yeah.
Well, and compounded is a week, a full-time week. Yeah. Sorry, Amanda.
No, I was just going to say, and if I'm, the person on in the crisis, right. And I came and I'm trying to figure out all these other pieces of my day to day. If I missed a phone call, that automated, a phone call reminder, that automated text message that, oh yeah, I was supposed to do X, Y, Z. Oh, I have 2 days to do it. Yes. That is what the person who's living and breathing in the crisis may need in that moment. So
yeah, again, this past week, right? I was in a part of the hospital. I wasn't allowed to have my phone, or I wasn't getting reception, and I missed like 4 different calls that were gonna decide on something that like happened afterwards. And so then I'd have to leave that part of the hospital. I'd have to go back outside. I'd have to make the phone call, right? Like, or simply, I think about people who are calling after hours when somebody's open. If I work third shift and I need help, how am I going to get help? Because I only get 15 minutes to eat my dinner, and then I got to get back on the floor. So what happens for that person who is going to sit on hold potentially for however long?
Yeah.
Right. Like there's all kinds of, I think, opportunities.
Yeah. Saturday makes the most sense. Right. And I need to do it at Saturday at 5 a.m.
Yep.
I should be able to do it and access it Saturday at 5 a.m.
Right. Yeah. So I know this is not going to be the only time. I know that we touch on AI. I know that there's going to be more to come. The summit is just, I think, kind of the kickoff to more learning in a lot of ways. We'll listen to the folks who attend and see where else we can be helpful, and are excited about bringing a lot of people together to hopefully create some forward momentum. We're bringing some great vendors, and there's such a great mix of topics. So if you haven't checked it out yet, go to CAAP.org. The top link there on the website, it'll take you to the summit for more information. You can get registered. If you're on LinkedIn, I'm sure you've seen it on LinkedIn, because you can't even scroll a little bit without seeing something about CAAP on LinkedIn or yours truly. Thank you very much, Holloway Media Services, for that.
You got it. Our pleasure.
Amanda, thank you for spending a little bit of time today. Anything else you want to shout out or call out?
Not really, except to just give you your own personal kudos for always kind of like leading the innovation within this network. Yes, I've done it for, I don't know, I keep changing the number. I'm about to say 10 years. It's probably closer to 17, but I don't actually know. But I've done this work for quite a long time. And, I have, from the time that I met you, just the way that you think about it, how you have moved Pennsylvania forward, but more importantly, your ability to your willingness, I should say, to just share with the rest of us. It has now pushed Texas forward. It pushes other states forward. And so thank you for that and the work that you do. I don't know how often you get your kudos and your shout outs, but you are absolutely amazing at what you do. And more importantly, because you're willing to just give it to everybody else. And so thank you for that.
Well, it's
you are doing more for people and communities than you realize.
Well, thank you. I appreciate that. And if I can do just a little thing to help, then always willing to do so. So thank you very much for saying that. I appreciate you. And same goes back to you, because you have been my phone a friend since the day that we spent our first time talking together. I remember I was at the Turkey Hill parking lot at a gas station because I was on the road, and we talked for, I think, like an hour and a half about the things that we were doing, and you were trying to figure out some things in Texas. And you've just been somebody that I can rely on and be like, hey, I have this crazy idea. What do you think? And just so I always appreciate you taking the phone call.
Of course. Anytime.
All right, Heather, any shout outs before we wrap?
Well, I just feel like I want to jump on this love fest. Amanda, it was so amazing to meet you. And
thank you too.
Heather, not to give any criticism or anything, but if you had been at the fall conference, you would have gotten to meet Amanda in person, because she came to
I was there
and hung out for a little
bit. I was taking all the notes and figuring out how I was going to change my conference.
I was out of the country, or I would have been there. But no, I mean, I just want to say, thank you for doing the work you do in Texas, and for taking care of your residents. And it's more people like you and Beck needed now more than ever. So thank you to both of you for taking care of our neighbors.
Thank you for that. If you're looking to learn a little bit more about the association that Amanda supports as the executive director CEO there, TACAA, hold me accountable here, Amanda. TACAA.org.
.org. Yes.
There it is.
Check her out. Check out what they're up to as an association. Find out about local agencies there. Think about dedicating time, resources, dollars, whatever that looks like, to the organizations that are local to you in Texas. Or check us out at thecaap.org. Thanks everybody for listening, putting on your thinking caps for a little bit, and we'll check you the next time. Thanks for hanging out.
Thank you for being a part of this episode of the Thinking CAAP. Check the show notes for resources and links to other episodes. And don't forget to subscribe and follow to be notified when new episodes are released. If you have any community action questions you'd like Beck or one of our local experts to answer in a future episode, please email your questions about community action to info@thecaap.org. Subject line, Thinking CAAP.